How many of you guys have used Cellvizio before? Oh, great. So it sounds like it was at least majority of you. So for the beginners,
You guys.
for the beginners, it's pretty simple to turn on. The only confusing thing is there's two buttons. So we have a power button up here and a power button down here. So we have to hit both of them and turn it on. Wait about a minute or so to let it boot up. Right when you see this home screen, this area will be blinking. That's where we're going to put in the patient information. So usually we do MRN number. So right now I'm just going to write test, just so we know it's not an actual patient. Hit enter. They want to go ahead and grab our probe. So Dr. Gonda's question.
What is this for?
So that's a great question. So this gives us a chance to look at the cells in real time. So what Dr. Gonda is using it for is pancreatic cysts. So he uses the US to get down to the cyst, 19 gauge needle to get into the cyst, and then he puts this through the 19 gauge needle to examine the wall of the cyst so you can look at the cells. We also use it in the esophagus for Barrett's esophagus, for mapping out treatment sites like RFA ablation, cryotherapy, things like that. But for you guys, we're mainly just going to be using it for pancreatic cysts. So let's just worry about that for now. So this is a demo probe. It's a little bit shorter than the probes that you guys have. It's just not much shorter, but just
Is this the one we usually have for CFPD?
Yes,
Yeah.
it's called the AQ Flex probe. We have two, and they're in KP3.
Yeah, so that's one thing we do want to know. We want to make sure we're using the AQ Flex. We have different types of probes. The one that fits down the 19 gauge needle is the AQ Flex. So if they send up a different one, you're going to get it open, you're going to get everything set up, you're going to go to put it through the needle, and it's not going to fit. And then you're going to start freaking out because the case is about to start, and you might not have enough time to get the next one from CSP. So before we plug the probe in, we want to grab this funky little camera looking thing. When you press down this blue button, it exposes this microfiber cloth. Think of this like cleaning your glasses or just a lens on anything. So you want to grab this portion of the probe and put it right here, and you want to rub it on here until you start hearing a squeak. If you don't hear a squeak right away, just close this and open it back up and do it again, and you'll start hearing that squeak. Okay? So after that, go ahead. So since this is a demo probe, it doesn't have it, but there should be an arrow right here with the name of the probe on it. So it'll have a blue arrow, it'll say AQ Flex. That's the one you want to grab. And you want that blue arrow pointing up when you plug it in. So you're going to plug it in here, and then make sure you turn it all the way to the right until you feel it click. A lot of people get tripped up on this. It turns a lot further than you would expect. You're going to need two hands to do it, one to hold the probe in there and then the other one to turn it all the way. If you don't feel that click, you might think that it's plugged in because this message might pop up, but it's not locked, so it'll just slip out anytime there's tension on it. So once you hear that click, you know that's plugged in nice and tight. This message will pop up. It usually takes about 30 seconds or so to calibrate. If this fails, then most likely the probe isn't clean. So you want to unplug it, grab this, go ahead and clean it again, and then try to plug it in again. Plug it in. If that happens again, then maybe take an alcohol swab to it to wipe off any excess debris that might be there. So once you have this plugged in and you see that message pop up, you can go ahead and grab the needle. So what we use is the 19 gauge FNA needle. So it could be any FNA, 19 gauge FNA needle. We usually grab the Boston Slimline. Like I said, this is just one that we typically use. I mean, Cook has a 19 gauge FNA needle. There's plenty of them that will work, but this is just one we've been grabbing. So I feel like Dr. Gonda is most familiar with this one. Does anyone have any questions so far while I open this up?
How many lives does the probe have?
So the probe has 10 lives. This is a demo probe, so it doesn't have it exactly how you're going to see it, but there's going to be a number right here where it says not for human use. Once it drops below 5, that's going to turn red. You want to keep an eye on that because let's say, so when you plug it in, if it says 1 use, that means the use that you're about to use is the last one. So after that, we can go ahead and throw it out. If we don't throw it out, and whoever's next to use it, it's going to plug it in. It's going to just say that there's no more lives left for the probe, and they're going to throw it out and call it down and grab a new one. I will show you the life in case. 10.
You send it down to blue or what? What? You send it down to blue? This one?
This is his demo.
Well, I mean, this is like that.
It comes in a sterile container.
Is it the end of CSPD or the?
KP3 regular, steam sterilized.
Ty, do you have any more of the devices laying around? I'm gonna have to try to order you some, so I don't see any in here. So in this drawer there will be these locking devices. What this does is it's going to keep the probe attached to this needle. So what I'm going to do is remove this stylet. I'm just going to ask you to be my extra set of hands. This here. I'm going to open this. It's called a locking device. So I'm just going to take this, screw it onto the back end of the needle here. And then we're going to go ahead. So my probe's not going to fit down because it's not the same width as the AQ flex. It would be more similar to one of the larger needles. We're going to feed this through here. Okay, so we're going to feed that all the way through until it comes out of the tip of the needle. So I just put it on 3. I feel like most doctors usually work in that area, but it depends on where the cyst is in the pancreas. So we're going to feed this all the way through. Sorry if I until it's sticking out of the needle just like that. So it's going to stick out about maybe 3 to 4 millimeters. So we do this before we go into the cyst. This way Dr. Gonda has an idea of where the probe is in relation to the needle. So if we were to wait until the needle is inside of the cyst and then feed the probe through, Dr. Gonda is going to have trouble picking up the tip of the probe on the EUS. So he's going to have, it's just not going to be sure where the probe is in relation to that needle. The needle is really easy to see on the EUS, the probe not so much. So that's how we take the extra time to do that on the front end instead of waiting until during the case to do it. So once you have that probe sticking out 3 to 4 millimeters just like that, we're going to go ahead and twist this wing nut here to tighten it. So that's going to lock the probe into place. So it's not going to move from this set location like that. Does that make sense to everyone? It's kind of hard to describe when we don't have the probe going through the needle. So just imagine that probe coming out of the hub of the needle rather than being to the side of it. Okay. So locking this here is going to keep that probe just like that. That's set 3 to 4 millimeters. At that point, we're going to unscrew this and just let it dangle. So with this, so just imagine that the probe is going through this portion, so it has something to hang on to.
Very similar to Dr. Haber's little piece of tape.
What was that?
Dr. Haber uses a little piece of tape so he knows by feel where his tool is behind him. So when it comes out, when the tape is at the biopsy channel, that's why he knows where he's in his working length.
Perfect. Yeah, so this will be hanging just like that. And what that's going to do is going to take the probe from here to sitting inside of the hub of the needle, just like that. This way when we go to pierce the cyst, it's the needle that's making contact with the cyst rather than the probe. Okay? At that point, you're ready to go. The needle is set up. So the needle's set up, the probe is ready to go. So you're just going to put this off to the side and wait for Dr. Gonda to be ready to actually puncture the cyst and examine it. Once he's ready, he's going to administer fluorescein. So we want to make sure that we order the fluorescein ahead of time just because it's not something that anesthesia deals with very often. So
It's in the Omnicell.
it should be in the Omnicell, but sometimes it's not just because it's not something that's commonly ordered. So we want to make sure well ahead of the case that the fluorescein is available. This way, if it's not in the Omnicell, we can call down to the pharmacy and get it here in time. Fluorescein, they're going to inject this entire vial with 5 mLs. They're going to do a 0.5 ml test dose and then administer the remaining 4.5 milliliters. Does that make sense?
Mm-hmm.
IV, yep. So they administer it intravenously. And what this is, it's just a highlighter for the cells. So if we weren't to use this, then it would just be, imagine like a dark room. When we use the fluorescein, it's like turning the lights on. So you can actually see what's inside, see the cells inside the body. When we go to actually use the system, we have the option of either using this trackball here or the foot pedal. So do you remember if Dr. Gonda prefers the foot pedal, or I think he prefers us starting it outside the case and just using this. But they work the same way. So the blue one here is the same as the blue on the foot pedal. The gray on here is the same as the gray on the foot pedal. So to start your imaging, we're just gonna hit the blue. So this is really dirty, this probe. As you can see, all the spots on here. So after I go through the demo, I'll clean that and try to get that off for you. So pressing the blue button, the play button, whatever you want to call it, will be like pulling up the camera on your phone, but not taking a picture. So you're able to see things, but you're not recording anything. Once you hit this gray button, that's when it's actually going to start recording. So you'll see this message pop up below. I should try to look at those. So here's just the fibers on my shirt. Play around and actually look at your skin cells. So
How strong is the microscope?
it is
Or the lens?
magnified 1100. Yeah, 1100x. Yeah. So
Wow, cool.
yeah. Anyone want to try it? Yeah, yeah. There we go.
Let me see what I have.
What do you have?
Diameter.
That looks like some young skin.
And then Connor, can you tell me about the recording? Because I know that they take the images out, or they have you guys usually take the images out. What's the recording about?
Yeah. So once we're done with the case, we're going to go ahead and hit that record button again. That'll stop recording. Now that, as you can see, the lens is still going, so I just like to hit pause, just so there's not a bunch of static on the screen, so it's not distracting. But once you're done with the case, you can go ahead and, once you highlight it, you can go back and look at the case itself. So if we hit pause, we can actually go and scroll with this trackball. So let's say Dr. Gonda was in the case, there was an area that he found interesting and he wanted to go back and look at it. Once you have that video playing, you can press pause again, and then this will give you that like frame to frame video. So you can go ahead and you're like, oh wow, this was the interesting part. Let's try to look a little bit deeper. You can also go ahead and tag the images. Not many people use that, but it would be this text box right here. So it's just a square with a T on it. You just hit that text box, and you say, head of pancreas cyst. And this way everyone knows where it's at. Press the text box again, and then it's labeled. Now what Tara was asking was how to export the video, which is actually really simple. So let me grab my USB drive. Should have one in here.
This is not something we do, but just for context, at the end of this is Dr. Gonda is using this for research cases, a part of a study. So we call in Connor when we have a case that's boarded, if he can make it. If not, he comes by FaceTime. But Dr. Gonda uses these images via the jump drive after the case for his research.
And this is actually really simple. So you just take your USB drive, plug it in right here,